Screening and panel discussion for Behind the Joy, a film by Jamal Smart. This film explores the often hidden struggles of postpartum depression. Panelist Joy Williams, Moderator, Allan Toles, MD OBGYN, Northwell Health, Chioma Okoro, MPH Director, Community Health Center, Karen Lockworth, MSN-RN, Icon School of Medicine, Mount Sinai's Doula Program, Beatrice Goodman, MSN-Ed RN, Ribbons Praise Dance Leader, SoulJoy Wellness, Shondell Nicole Goodridge, MHCLP Therapist, Helping Hands, Psychotherapy.
I feel like I'm going crazy.
Bringing a child into this world is tough on everyone, physically and mentally.
What's going on with you? Ever since you came back from the hospital, you ain't been the same. Naomi, you left my daughter on a coffee table in the middle of the living room.
I'm starting to believe postpartum depression is real, bro.
Nah, bro, that stuff is not real. The nurse is trying to say something like that. My mom never went through anything like that.
John, I need you to hear Naomi, because there's gonna come a time that you will not be able to hear the Naomi that you know and love anymore.
You wanted to what?
Nothing.
She's an accomplished healthcare professional, educator, and community advocate with over 37 years of experience in nursing and healthcare consulting. Currently a doctor of nursing practice, research educator candidate, she is deeply committed to advancing nursing education and clinical practices through research, leadership, and innovation. You would agree, right? As a passionate and dynamic motivational speaker, Beatrice inspires students, are you inspired? Colleagues and healthcare leaders to pursue excellence in patient care and nursing practice. Beatrice is expanding her mission of wellness and empowerment. So her teaching philosophy blends deep clinical expertise, strong communication skills, and lifelong dedication to learning. She is also the CEO and founder of Goodman Russell Consulting Corporation, where she brings over a decade of experience in healthcare consulting. So, and I know her well because we attend the same church, and she has developed Ribbon Dance Fitness, which is a moving meditation. And next we will hear from Beatrice Goodman.
Thank you, Joy. And Joy forgot that I work with her, and she has me out and about doing those things that I love to do. So give Joy a round of applause. So has everyone in the room received a streamer? Yeah? Good. So as we get started this evening, just a little bit of background, what streamers represent, and how we tie them into a variety of things. So tonight we're coming to create a space for healing our body, our mind, and our spirit through movement, worship, and using vibrant colors. So for many, especially mothers navigating postpartum depression, words sometimes fall short, but the body remembers. The heart holds stories, and they are met at their point of need through motion. So the use of these beautiful ribbons and streamers that we're going to use tonight helps them, and it symbolizes peace, tranquility, energy, vibrancy, and it helps to minimize stress and help us with our emotions. So what we're going to do is use our streamers. Everyone is going to stand up, and you're really going to follow me, right? And if you look around at the beautiful colors as they're waving around in the air, it decreases your anxiety levels, and it does this creating your body's ability to work out freely and just release. So the first one, I'm going to tell us how we are going to move, and you can follow me. The second song, at that point, you will have felt so comfortable that you'll be able to do whatever you need to do with that streamer. So I use it, and I call them my banners of warfare. That's what I really use my streamers as. And I help them to wipe out any stresses that I have and anything that may potentially be bothering me. I just focus in on the streamers, look at the beautiful color waving around, and I become more and more relaxed. With that said, please, the first song. So for every time we hear atmosphere, we're going to go around like this. Every time we hear the word miracles, we're going to go like this. Right? Atmosphere is over your head. And fan for your miracles. It's all in your bed. We're going to walk around.
Miracles take place in the atmosphere of faith. You can be changed. In the atmosphere of faith. In the presence of miracles take place. Miracles take place. You can be changed. In the atmosphere of faith. In the very presence of God. In the atmosphere. Listen. Do you wanna be changed today? Yes, you can be changed today. Do you wanna be changed today? It's in the atmosphere. Do you wanna be changed today? Yes, you can be changed today. Do you wanna be changed today? What you need is in the atmosphere. What you need is in the atmosphere. Reach out, reach out. Oh, just believe. It's in your faith. What you need from Jesus. It's in the atmosphere. Just believe. Healing, forgiveness. You're right yourself real today. It's in the atmosphere of faith. So why not you? Why not now? Why not right now? In the atmosphere of faith. Why not you? Why not now? Why not right now? Why not you? Why not today? Why not right now? You can have what you need today. It's possible. Why not right too late if you have faith. No matter what the situation, I know that it's gonna work out. So don't doubt. No matter what the problem is, it's never too late. It's never too late. Have a little faith. No matter what the situation, I know that it's gonna work out. So don't doubt. Don't you doubt. Never doubt. Don't you doubt.
Song comes on, row by row. There's one more song, that's right, next song. So, what's gonna happen? We're gonna start twirling. Alright, so row by row, we're gonna walk around the room. Around the chair. So starting with the first row, please. Follow behind me, follow the leader. Row 2. Row 3.
Remind me once again just who I am, because I need to know. Ooh, oh, you say I'm loved when I can't feel a thing. You say I'm strong when I think I'm weak. And you say I am held when I am falling short. And when I don't belong, oh, you say I am yours. And I believe, oh, I believe what you say of me. I believe the only thing that matters now is everything you think of me. In you I find my worth, in you I find my identity. Ooh, oh, you say I'm loved when I can't feel a thing. You say I'm strong when I think I'm weak. And you say I am held when I am falling short. When I don't belong, oh, you say I am yours. And I believe, oh, I believe what you say of me. Oh, I believe. Taking all I have and now I'm laying it at your feet. You'll have every failure, God. You'll have every victory. Ooh, oh, you say I'm loved when I can't feel a thing. You say I am strong when I think I am weak. You say I am held when I am falling short. When I don't belong, oh, you say I'm yours.
It's a way to engage yourself in exercise and also look at beautiful colors. Again, thank you all. I just want us to leave with, I'm always believing and trusting in affirmations. I'm doing my best. Everyone with me, please. I'm doing my best. I'm doing my best. Which is enough. Which is enough. It's okay. It's okay. To ask for help. To ask for help. My feelings are valid. My feelings are valid. And I'm not alone. And I'm not alone. I am doing my best. I am doing my best. Which is enough. Which is enough. Give yourselves a round of applause. Thank you.
That was great. So we're going to do a couple more things right before we show the film. So we're going to be shortly. So I'm going to do 2 introductions. We wanted to hear a welcome from the chair of the Nassau County Perinatal Services Network. And let me tell you a few things about her. A few things. And this is Melrose B. Corley. She has a master's in public administration. She is a nonprofit senior executive, author, certified life coach, credentialed group facilitator, and trainer with more than 4 decades of experience in nonprofit leadership. Her expertise spans strategic planning, program management, grant writing, training, and policy development. Melrose holds a bachelor's degree in Human Development and Family Studies from Cornell University and a master's degree in Public Administration and Nonprofit Management from Long Island University's CW Post. She is a proud member of the Phi Alpha National Honor Society for Public Affairs and Administration, and she is also a doula. And she is a proud parent of one son, Bryce. So here we hear from Melrose B. Corley.
Thank you. And if my son were here, I would embarrass him because I say he's single, ladies. He has a job, he has benefits, but you gotta move to Chicago. That's the only thing. He loves when I say that. Right? You remember. So, thank you so much for joining us tonight for tonight's screening of Behind the Joy. As you know, my name is Melrose Corley, and I'm the chairperson of the Nassau County Perinatal Services Network, and I'm so honored to welcome you here this evening. Our network is deeply committed to supporting the health and well-being of women, infants, and families throughout Nassau County. Through our 3 work groups, and as I mentioned earlier, Outreach and Education, the coordinators of tonight's screening, the Perinatal Mental Health and the Perinatal Disparity Work Group, we strive to improve birth outcomes by reducing perinatal health disparities in Nassau County. We are a collaboration of voluntary organizations. We don't get paid and we don't have a budget. However, as volunteers, we have organized to address issues that impact healthy birth outcomes, such as infant mortality and health disparities. Behind the Joy gives us a powerful look into the often unseen realities of pregnancy, birth, and early parenting. While these moments of being a parent and birthing a child are often portrayed as joyful, many individuals face deep emotional challenges, loneliness, anxiety, depression, and trauma. And far too often, they do it in silence. It is our hope tonight that this film will help us to understand these emotional challenges, especially the silence. And you heard some of that in the previews if you were listening. So it is our hope that this film will open your mind to the unspoken experiences behind the expectations that childbirth is a joy. It is in many instances for some people. And in this month, when we bring awareness to maternal mental health, it reminds us that perinatal mental health matters, that every single story is valid, and that there is more that we talk about than what happens in Behind the Joy. And as we look and listen to Behind the Joy, we understand that we need to support those who are going through it. And I'm not sure where's Miss Beatrice. I don't know, I know you have students, but I don't know where they're from. I don't know what they're studying. I just see a lot of burgundy and white in here, and I'm not sure what that's all about. So I want someone,
Jasmine?
This is Miss Jasmine.
Jasmine.
And then I'm going to call on someone else. Because, you know, like Miss Beatrice, she used to work she used to work right down the hall, right down the walkway. And I'm a trainer. And if you don't speak up, I'm going to call on you. So I'm just trying to see who's looking at me that I can call on so you can tell me. And so that means if you look away, I'm going to get you. Tell me about your school and about what you're doing.
We're in nursing school. We have a small school, so it's very family-like. Everybody knows each other in the building. We see each other all day long.
Where are you located?
We're in Queens in College Point.
Okay.
What's the name of school? Transitions Career Institute.
And you're studying, what are the different majors or?
We're all going to become LPNs.
Okay, again, I don't know what that means. There's no nurse.
Licensed practical nurse.
Thank you. Someone, I need one other person.
Thank you, one other person. I want to call on someone. It's this lady right here, the glasses, right here.
See, that's who I call.
No, right here. Sitting next to the lady in the black. You looking around. Yes. Come on down, right? Come on down. They may be too young for that. Our price is right. Come on down, come on. Tell me about your school and about what you're doing.
Good evening. My name is Julius. We are from Transition Career Institute. We're studying for LPN to become a nurse.
Okay, thank you.
Thank you so much. And not to be, I think I saw a gentleman in here. All right. Great. I can't say to everyone.
Good afternoon, everyone. My name is everybody. I'm from TCI, and we are all trying to get the licensed practitioners, and from there we will move forward. And best of luck for us. Thank you.
And I know that your teacher, Beatrice, is an excellent teacher, and you will get there. I know that for sure. So she's standing here. I have to finish up. So by being here tonight, you are helping to break down the stigma of postpartum depression. You are part of this space in which we encourage honest dialogue, and we encourage you when the panel comes up here to make sure you ask the questions. And you are now taking a step forward toward a future where every individual of childbearing age can feel engaged, educated, and empowered. So again, after the screening, like I said, we invite you to stay for our panel discussion, and we thank you again for being with us this evening. Thank you.
Thank you. So one more introduction for Kimberly M. Robinson, DHSC, NPH, MS. A lot of letters. She has dedicated over 20 years to advancing public health through a unique blend of experience in biology, environmental health, and community engagement. She currently serves as the director of the Office of Health Equity at Nassau County Department of Health, where she leads initiatives aimed at addressing health disparities and promoting equitable care access for all communities. And that is the office that the Nassau County Perinatal Services Network is formed under. She's also an adjunct professor at Nassau Community College, where she teaches introductory and advanced biology courses, empowering students with knowledge in health sciences. And just a little bit more. So she has a deep commitment to public service. Dr. Robinson is passionate about fostering collaborations, implementing evidence-based strategies, and ensuring that all communities, especially those historically underserved, have access to quality health care and resources to achieve optimal health. Dr. Robinson.
Thank you, Joy. On behalf of the Perinatal Services Network,
We deeply appreciate all of you, and of course, Mr. Jamal Smart for his creative vision and showcasing Behind the Joy. This is very important to us, as this is also Black Maternal Health Week, so we're bringing awareness to that as well. Postpartum care is a critical but often overlooked part of maternal health. Comprehensive support in the weeks after birth, including physical recovery, mental health resources, lactation support, and community care can significantly improve outcomes for mothers and their babies. Ensuring access to culturally responsive postpartum care is essential in closing the gap in maternal health inequities. We want to promote solutions, ensure safe, respectful, and quality care before and after, and of course during the pregnancy. I am so grateful for all of you here today, and I hope you enjoyed tonight. Thank you.
So one last person, now I'm not gonna give a big bio because we can do that. The bio is actually on the screen ahead of us. So we wanna meet the filmmaker and think of all the things the filmmaker did, because he did so many roles himself. He is the producer, he is the director. He's done so many things. Jamal, I don't see you. Did you disappear? There you are. So we want to learn from that. How many of you have actually been to a film screening and you had the filmmaker with you? Only a couple hands, right? So we're excited about the opportunity, and he is really marketing this film. There's a lot that goes into it, promoting this film, and he is really advocating for health and mental health. So Jamal?
I don't have a big speech like all day. I'm just gonna say something that I just wrote down, but I appreciate everyone for coming. I know obviously it's mandatory. I love the burden and everything. So for those who may not know me, you probably heard my name my name is Jamal Smart. I'm the filmmaker for Behind the Joy, right? So before this film, I was just a guy with a camera shooting music videos or commercials and just random things, thinking that world star hip hop would be the biggest thing ever, right? So I worked behind the scenes on sets, contributing my projects to BET, VH1, fashion campaigns, music artists. On paper, I was checking off all these milestones, but something was missing. I was kept asking myself, what am I leaving behind? What am I impacting? What am I doing something for the world to make everything better? So the vision for Behind the Joy came to me. This film is more than a story. It's a message. It's a mirror and hopefully a movement. It shines a light on postpartum depression, the silent struggles so many mothers and Black mothers face after childbirth. In our community, we're often told to be strong or to push through it or to get over it. But mental health matters. These conversations matter, and we need to make space for them. I want to say thank you to Joy Williams for reaching out to me to do this screening. It means a lot for something that I sat there and wrote to become this big, for everyone to come and see and actually be, interested. And just working with Nassau County is crazy. I used to get a lot of tickets in Nassau County. So this is crazy for me. It's like a full circle moment. And I just want to say thank you to all for coming tonight. I hope Behind the Joy touches you, starts the conversation, and reminds you that healing starts with listening and telling the truth.
1 hour later.
Hello, everybody. I hope you like the movie. First, I want to bring on some of the actors. We have Meagan Salfarlie here and Darnel Thomas. They don't know I'm calling them up here, so get up. Let's go. Yeah, she was the mean friend. She's not that mean though, right? And he was the friend that's trying to tell him like, yo, you should check on your girl. And I want to give a big I want to give some of the crew here. I have Gary. Come on, Gary, come up here. You're moving slow. You gonna put the popcorn down? You're gonna And I just wanna thank everyone for coming. I know you probably didn't come for me, but I just want to thank everyone for seeing this and thank my community for being here to put this movie out. I don't know, do you want to say anything? Because I'm out of words.
You know, I always have something to say. Everyone, welcome. Thank you for coming to this event. I hope you enjoyed the movie. I hope I've seen some tight backs that didn't like my scene. I was watching everyone. I see like, oh, and then I was, you guys, and then some tears. I saw some tears in the audience at the end as well, which means that it touched your heart. And that was what it was meant to do and make a move. So because of him and his direction, we were able to portray this movie and the imagination that the creator gave you, and grateful to be a part of it. And thank you for enjoying it at Behind the Joy. Thank you.
Thank you so much. All right. We're done. All right. Thank you.
This is great. Thank you, actors. So how many of you have been to a screening where you see the actors and part of the crew? No. So this is your first time. It'll happen again because Jamal's going to be busy. So as we get ready, they're going to put some chairs on the stage, and so we can have a little conversation. So one thing about Jamal, he made his dream happen, right? I asked him how long it took from his getting started.
Good evening, everyone. My name is Yvonne. When the nurse first told him before she left the hospital, maybe you need to check into the fact that she has postpartum. She tested and we're telling you that this is what's going on. And because his wife was such a strong person, he knew her to be strong, right? He didn't pay any attention. He had no idea that that same strong woman was still strong, but not in the same way he knew her to be, because everything about her now has changed. And she even kept saying in her head, he's not seeing me, he's not hearing me. So the fact that he missed all of that, but he was pre-warned before he left the hospital, I thought that was very interesting. And Jamal, I just have to say, I saw a little bit of this before in Suffolk County, and because of this, Jamal, you have put me in the position to write a program that shows the cross-section, the intersection of substance use, mental health, and postpartum. So, my friend, I thank you for igniting a fire in me to help mothers also.
That is wonderful. That is what Jamal wants, right? He said it's a movement. So I'm going to ask all the panelists to come up to the stage now. So we put up Adelphi University School of Nursing with a Bachelor's of Science degree in nursing, holds a Master's of Science degree in nursing from Walden University, holds the position of Director of Nursing for Women's and Children's Division, Interim Director of Behavioral Health of a municipal hospital in New York City until her retirement. So in July of 2023. But she didn't stop there. She just didn't sit home. She is a doula who trains doulas.
Sorry, I am not a doula. I'm a doula trainer.
She's a doula trainer.
I didn't want to get up in the middle of the night, but I will train you.
Well, we appreciate that. She's a doula trainer. We appreciate that. So we have a couple trainers up here. And then Dr. Toles. So I know a lot about him, and he is an OBGYN. And he is OBGYN. I think I'll just share a little bit about him because finding it on my phone is a challenge. So, and he is in Northwell hospital systems. And you know, one of the great things I learned about him today is he gets to work with his daughter, who's an anesthesiologist. Isn't that exciting? So he's they come from a family of doctors, so this is exciting. He has 2 daughters who are doctors, so a little personal information. So to get started in the conversation, though, we heard from you what some of the impactful things were, But let's hear from some of the panelists, a couple, what were some impactful moments in this movie for you? We can share a microphone. Oh, do you have a couple?
Yeah.
Push it up. Yeah. But you can do this. You can use that one.
So for me, right after delivery, where she appeared very disconnected, said it all for me, right? Before the nurse even had a conversation with him, explaining to him what his scale was, what her scale was for postpartum depression, you could see immediately after delivering, she had a very blank look, disconnected.
What said it for me is when, before she even got to the hospital, she was in a car and she was hearing voices. He turned around and he asked her, who is she talking to? What did she say? And she kind of like just brushed it off. That for me stood out because for a person who is struggling already with mental health barriers, and now that they're pregnant, it exacerbates, right? So for her, she was clearly going through some signs and symptoms of postpartum psychosis.
What set it off is when she had the baby, and the baby was given to her. And for me, it's about the people who, not necessarily the person who just gave birth, but the people of care who were in the room. They set the motion, because they're more experienced. They see these things. They see one person to the next person, to the next person. And taking the man out to talk to him and saying all this, I don't see anywhere where anybody spoke to the mother about what she could be experiencing based on what they saw or the affects. So for me, yes, we can talk to the man, but if he's not informed or if there's biases behind whatever his information is, what about the mother who was already on psychotic medication?
I guess for me, one thing, again, as you said, they didn't really speak to the mom, but for me as well, when I had my children, I had a kind of a village around me, so people noticed things that, for me, a grandmother, a mother, she had no really support for her. At times when people have babies, there's a village around them, and sometimes that's not the case anymore. So the nurses in the hospitals have to really do their due diligence. And honestly, with a screen like that, she wouldn't have been able to go home where I work unless she was seen by social work, psychologist team, and to do a deeper dive into what was really going on to ensure there was a safe discharge at that time.
Good evening. I apologize. I'm coming from work. That's why I look this way. But I think what was most impactful for me was seeing from a male perspective of how we are not really in tune to what's happening with women in their peripartum and immediate postpartum periods. And it's good that there are a lot of women here in the audience, but it would be great if we had a larger male presence to see what it is that's really happening and see things from another side. So I think seeing that what happens from a male perspective and how we really don't perceive what's happening with a woman during a pregnancy and immediately post-delivery, and the emotional aspects of it and the psychosocial aspects that go along with it.
So, Dr. Toles, since you have a microphone, so when you've been a OBGYN for some years now, so when you see something, what is the natural course of what happens? What do you do to help in those situations?
Well, within our health system, we have a whole program designed and a whole system of, once we identify patients, of how they move through the system and helping them with peripartum issues, specifically adjustment disorders, mood disorders, anxiety disorders, depression, and we have a whole scoring process that goes along with that. Some of you are familiar with PHQ-9 testing and how that moves, how that identifies patients and helps us to help them navigate through the system and get them help as soon as they can.
So, and Karen, you, as you train doulas, because we talk about people having a community of help, so for some, we are assuming that everyone knows what a doula, but can you explain what a doula is, and that in these situations, how could a doula be helpful?
So, thank you. So the program that I was involved in was a community doula program. So these were doulas that were trained from the community in which the hospital was actually in, which was great because they spoke very many different languages, which is a community in Queens. They were trained on completing the PHQ-2 and 9. They also had resources at the hospital to call, and for social work, for director of nursing, for the OB department to refer. So they were trained to look for signs and symptoms of postpartum, and they would follow the clients from prenatal, labor and delivery, postpartum, and home visits. So they were able to develop a rapport and a relationship. So they were very keen into noticing things that were different, and they knew how to report up and where to report those things. So they had the tools to use to address those issues.
So are you seeing that more women of color are using doulas than years gone by?
The hope is that more women of color, and that's the reason that we started the community-based doula program at the hospital to support women of color, women who may not have support in the country to work with them. They don't know the hospital system. Navigating the hospital systems can be very difficult if you don't know the system. So they help and support them through the system. They were introduced to the hospital, to the obstetric department as a team. There was a lot of collaboration and communication about their role in the hospital and how to work as a doula in the confines of the hospital system.
Thank you. So Beatrice, now we did this ribbon dance fitness, which is meditation movement, so people can develop tools that can be helpful, but sometimes they need more. So in your experience, because you've done a number of things, how do you help people develop more tools, and then when would you refer them to someone else?
So in addition to just movement, right, because movement is one of the things that releases different chemicals in the body to raise the euphoria, right, to raise the happy mode in a person. In addition to that, I participate at times in helping women affirm themselves, helping individuals who are not feeling good about themselves. So if you recognize earlier, we did some of that. Meditation is another way. And then when you realize a person does not, and they don't have good coping tools, immediately that's the time to do a referral and a reference. And so that at that point in time, immediately they are sent over so that they can be reevaluated and be reassessed. I think one of the biggest things is us at this current time being here so that we can decrease the stigma and or the ideology that every woman who delivers and is in a good place, right? And so that's why a lot of times it's missed, because the belief is you just had a baby, you're supposed to be happy. You just had a baby, things are supposed to be good. And until we really make the connection that that's not necessarily true for every person, doing things like this will help everyone to be able to better recognize.
Thank you. So Nicole, when someone gets referred to you, because Helping Hands therapy is psychotherapy. Helping Hands psychotherapy, when you get a referral and someone's having an issue, what is a normal course, or is there a normal course that that when you deal with someone that is having postpartum depression?
When we do get a referral, what we do is, before anything, we send them about 4 to 5 assessments, because we want to see where they are. Because just because someone says that they might be having signs and symptoms of postpartum depression, we want to see where they are, how high it is, and what level of care we can provide for them. Because the thing is, postpartum depression is different from baby blues, right? Has everybody heard of baby blues? Yeah. So a lot of people feel that, oh, I just had a baby, I'll be okay, and that's it. But baby blues and postpartum depression has a duration of time. With baby blues, after 2 weeks, you'll feel like yourself, because it's all about just readjusting back to a schedule and getting things together for yourself as well as the baby. With postpartum depression, after that 2 weeks has passed, you're still feeling severely depressed, not wanting to eat, poor appetite, low energy, isolating yourself, then that's when we start to know that, okay, these are signs and symptoms of postpartum depression. When the person is experiencing voices, wanting to harm themselves on the baby, we know that this could be psychosis, and now we have to refer them out to get help immediately, because a lot of things happen that people, situations turn to fatalities, right? And the highest number of fatalities is amongst Black women. So we try to promote that there's a difference between baby blues, postpartum depression, and postpartum depression psychosis in the duration of it. And if in the movie, it showed every different dimension of it, but it showed more of postpartum depression psychosis. And because she already had a mental health barrier previously and stopped taking her medication, it exacerbated all of the symptoms, and to the point that she was not even able to manage. So someone like her coming to me, I will refer her out immediately to go to the hospital, because I can't do much for her, because all I'm thinking about is she gonna hurt herself or the baby. So that's my first instinct.
Thank you. So one of the things about it is, I think we stereotype in our minds what a person who is going through that kind of thing is. She must be, I don't know, but whatever you're thinking, because one of the things he started talking to her, we know she was an attorney, she had a high, powerful job, and he's perceived her as being strong. So I think we create these visions in our head that people shouldn't have those issues, or they won't have those issues, because if she's an attorney, they both seem to be doing well and all those things. So Chioma, because you are a mother, and you work in community health. So what are your experiences of people combating these stereotypes, and what have you experienced that you can share?
Having been told I'm a strong person as well, and going through childbirth, I experienced that. I experienced she's strong, and so because she's strong, nobody comes. I experienced the loneliness of strength. Where you're in the dark by yourself, having to deal with whatever you have to deal with. And so we're not just talking about the stigma that is around you, but some of the stigmas that are within you. Some of the biases you have to fight for yourself to be able to push forward. I experienced mine from the hospital, where the nurses, some of the nurses and the doctors just thought, they were done, their job was done, so they walked away. And so because I've worked, my mom was a midwife, and I've worked with midwives, I've worked in the health, worked in hospitals, worked with patients. I kind of knew what to look for within myself, and knew when I was slipping. But that's not okay. Because had I not had the background that I did, I wouldn't have asked for help when I did. I wouldn't have seen the signs when I did, because nobody else saw. And that I find in the community, and that's why I asked the first question, who's looking at the person? Because the person might not be informed. And in our communities, we have the stigmas and we try to combat it. Who do you want to be in the community? The person that combats the stigma, the person that notices that somebody else is embedded in that stigma and cannot move as a result of it, or the person who makes the move, like the gentleman who made this movie, and says we have to create a movement around this problem so that we can eradicate it completely.
Thank you. I know, Beatrice, you at one point, not so long ago, ran a program to help women at the Maternal and Infant Health program, so MITCH program. So share with us some of the things you did, and then you can share.
Okay, so it was through the Postpartum Resource Center where, again, we had a circle of caring for pregnancy and postpartum depression, anxiety support group, and I am an advanced facilitator for that. And we had women who experienced postpartum depression, and we met with them on Ms. Corley was a weekly basis. Ms. Corley spearheaded that on a weekly basis. And we did a number of things. If it's okay, can I call Ms. Chim so that she can share her testimony? Sure. Ms. Chim?
Hi. It's so funny that I have two daughters. One is Naomi. Her name is Naomi. And in the movie, I was like, oh, Naomi. So my name is Chim Arevalo. I went to her program. So I went through, excuse me if I cry, I meant not to cry because I'm an immigrant. So everything that she said you need that support, I didn't have. So when I have 3 kids, my first, I went through like a rough pregnancy. So when the second pregnancy came around, they told me that it's twins. And I was like, oh boy, how are we going to do this? I'm not working, I have no papers, only my husband is working, we live in a basement, and now I'm getting twins when everybody around me thought it's the most beautiful thing. But I didn't. So straight from whatever happened in that movie, I went through it. In the back, hi Pedro, he kept saying don't cry, because right from the hospital, I knew this is going to be a rough road. So my doctor actually caught it right before I left the hospital, and that's how come I got connected with her, because they said it's either you go on medication or you go for counseling. So since I was breastfeeding, they opted that let's try counseling. So I had to go for counseling for almost a year, right? For almost a year, and I think that saved my life. So we used to meet in an office. It's a conference room like this, but when you walk in, the lights are turned off. She had candles. The place was smelling beautiful. There was music playing around, and then it was a circle of about 10 women. On the left, that's where we would leave the strollers. So the whole point was you have to come with the babies. And for some reason, these were newborn babies. They would, for 2 hours, not a single baby would be crying. So there was a lot of crying, a lot of laughing, a lot of singing. This was a safe space for us. Everybody was saying what we knew. We were struggling with something up there. And then you have a new baby. I had two new babies. But every week, I used to look forward to those Mondays. The Mondays were beautiful. And would talk, like just release yourself from whatever was bothering you. And we had young mothers, older mothers, first-time mothers, second-time mothers. But by the time the program ended, after in 6 months and beyond, you could see that smile that every woman had come back. The sunshine came back into our lives. Thank you so much. We were able to love ourselves again, to love the babies again, and we had a little graduation ceremony after we graduated, because I think we had kind of saved the world. You know, we had kind of saved ourselves. We had saved the babies that, God forbid, would have done harm to them. But my twins are 11 years old now, and they kept asking me today, "Mommy, where are you going again?" I'm like, so, but I have my sister with me here and my husband there and my aunt, because that was the village that I would tell Anita, I would say, "Anita, I don't feel right. Something is not right. Why am I feeling like this?" You know, and then I would tell Pedro, I said, "I'm going to take a walk in CVS," because CVS was like just going down the aisle was like a relief for me. But if you form, I see a lot of women here. If you feel, you know when something doesn't feel right, seek help. There is help. Talk to your doctors. Talk to your friends. Somebody will listen. Thank you. Thank you. Okay, thank you.
So we want to open it up to if you have. My question is, today, the length of stay, or the time for, meaning the time that someone is in the hospital after delivery is what, 48 hours? So, for the kind of help that was portrayed in the film, how would they have handled that today? I understand you said that she wouldn't have been discharged, but 48 hours, people are out of the hospital. So how do you help prevent these things?
If someone, just like on a med-surg floor, if there's a lab value that's out of whack or an infection, they extend the length of stay. You have to have safe discharges, especially for baby. If you document correctly, you get paid for that. But you can't, you do more harm sending them home and something happens. The hospital will get faulted for that because they didn't make the correct assessment or the referral. So there is a length of stay, but it also goes along with how the patient is doing and what the assessment looks like when you make that assessment.
OB is not my obstetrics is not my background. This is a real story. Young woman who delivered. She was her second pregnancy, and when she delivered on Labor Day weekend. No, she delivered 2 days before Labor Day, and so she was going to be discharged, but yet she said my ankles are like balloons. I don't feel well, and I said to her, tell them this is an unsafe discharge if you go home, because if you have a problem, when they were going to discharge her the Friday, Monday was going to be the holiday, and so if she was going to have the baby here in Rockville Center, and she lived all the way out in Far Rockaway. So if she had a problem, she would not go back. She would go to the nearest hospital, which would be St. John's. My concern is that are the people today in the hospital, the doctors and nurses, really are tuned and really using those assessment tools at all? That's one question. The second thing is, I tell people, you have to become your best advocate, okay?
Thank you for that question. I was going to make that point about having an advocate. And I'll say this in general, for medicine in general, whatever field it is, we're talking obstetrics tonight, but you would, I think your best approach to seeking medical care is first looking for and aligning yourself with someone who's going to be your advocate. There's a good friend of mine who's retiring from medicine, who has an office in Freeport. But he was so popular as a physician because he was an advocate for all of his patients. He would call them late at night with results, etc. And he would, every time I would ask him to come and speak, he would talk specifically about make sure that you align yourself with your medical care, but someone who's going to advocate for you. To your point, at the hospital, in my hospital system, in specific, I work at Long Island Jewish Medical Center. Patients, depending on how their delivery proceeds and whether it's vaginal or cesarean, they may go home in 1 day, 2 days, 3 days, 4 days, 5 days. But each one of those patients are assessed through the birth certificate office and through social work prior to them leaving the hospital about their overall financial situation, their emotional situation, and if anything is not right or is suspect, and our staff are trained in this to look for these things to make sure that they get help and are aligned with services prior to leaving the hospital.
Thank you. I'd just like to add the reason that I'm so passionate about doulas working in hospitals. Doulas are absolute patient advocates. They advocate for their patients. They bring them knowledge about the hospital system. So for someone who's alone in the country, they develop really great relationships to help them navigate through the system and work along with the hospital as a team to advocate for them. Because regardless of them being in the hospital, their first responsibility is the patient.
Be mindful though, not all the hospitals have doulas. So the community hospitals maybe now more so than they did previously, but the private hospitals do not. That is an extra paid service. Right?
Medicaid can cover doulas.
Now maybe. 8 years ago they didn't. Yeah, it depends. They didn't because I know I asked for it and it wasn't given to me. So, and that was 9 years ago because my son was going to be there. So, yes, they are great advocates, and that's why I wanted a doula. But in certain hospitals, I gave birth in New York Presbyterian Hospital, that was not available. Depending on the insurance that you had, you didn't have that. So just be mindful of that. I don't know if New York Presbyterian has it now as part of their program, but they didn't have it then. So be careful.
I just also want to add, we have to be conscious and mindful of a few things, right? One of them is different hospitals and different individuals look and deal with things, some with passion and compassion, while others do not. And we're good for firing people for all sorts of things. If you're not getting what you need to fire them just like you fire everybody else, right? Your hair's not being done properly, you get rid of that person. Your nails aren't done right, you get rid of that person. Just, if the connection is not there, find someone who is, and that's the other thing we have to do, as Dr. Toles said, advocate for ourselves.
Good evening. Okay, so my name is Courage Faustin, and I am a student at TCI. So TCI is a great school for nursing. So if you have a family of friends, welcome to TCI. So actually, my question will be based on the movie. So actually, I'm doing pharmacology. Okay, so I'm learning the drugs, like side effect and adverse reaction of the drug. So she was on the psych meds, right? And then she stopped taking her medication, and then went through depression right after having baby, right? So, and then her behavior was based on psych, maybe because she stopped taking the medication and the depression. But I'm like a little confused. So which part of the movie, the one that the behavior, like one of them that was the side of the depression and the side of the stopping taking the medication. So I just want somebody that clarify for me.
You have a couple people that might be able to help add some insight on that. So she's trying to figure out, she was on medication. She stopped taking medication. Like, what was really the problem? Like,
Was it the stop of the
was it stopping of the medication?
I mean, I said that you could probably give one of the examples of the video from the movie, saying that that was the side effect of the medication,
or the side effect of the medication.
Side. I
don't think it's that conundrum. So the question is, she was on psych medication prior to pregnancy because she had the panic attack, and then she stopped. So she's asking which of the symptoms that were displayed shows for the stopping of the medication, and which one was more towards the postpartum.
Probably both. It's probably hard to determine. Again, not having the benefit of knowing what her pre-pregnancy diagnosis was. There are several psychiatric disorders that require different medications. There are diagnoses that require certain types of medications, phenothiazines, butorphanones, SSRIs, and stopping those medications, all of them have different effects, and stopping them will give you certain effects after being on them and then stopping them. Once you become postpartum, they may be exacerbated. It just may exacerbate all of those symptoms. So it's hard to differentiate which one it is, but that's why you need a psychiatrist to think.
Because I know if a patient is getting.
Let her talk in the mic, please. Talk in the mic.
The side effect could be. Okay. So maybe blurred vision and hallucination, confusion, probably most side of the medication instead of of the side, let's say the depression side. That's why I just wanna know which one was based on the medications you stop taking, which is like I would say the side effect or the adverse reaction of the stopping taking medication, and the depression after this one. Okay, I was confused myself. That's why I asked the question.
Yeah, so we're gonna take. Thank you. Yeah, we're gonna answer 2 more questions, and then.
Thank you.
Oh, you have one. Okay.
I'm Jolie McLean. I just have a quick question. I think yesterday on the news, there was a woman who was from Queens. I'm sure somebody might have seen it. She's from Queens, and she had 2 babies. She had twins. And she went home, and she was home for 2 weeks. And then on the news last night, it shows, she died. And so this is something that just happened. It's on the news. It was yesterday. And I think I sent it to Joy just to show it to her. I'm like, well, this is really happening right now, and it's happening within our brains, within Queens, Long Island area. And I'm just thinking, like, well, the lady asked the question before, but what is the time when someone has a cesarean? How long should they be in the hospital? Or if someone has, does it naturally? How long should they really be in the hospital so that these things could be detected? Because she went home, I think they said she went home in a day. I don't think she went in a day. It was probably, she had twins, so it was probably cesarean, but I don't know. But she died 2 weeks later, and her mom is distressed, and the grandmother has to raise the kids now, and it's a whole thing. But it's just that, what is the right time to come home after cesarean, and what's the right time to come home after natural birth?
I don't know if there's one right time in which a person can go home. There are some people who have uncomplicated vaginal deliveries, who have children at home, who are doing well, who want to go home the very next day. Our hospital requires that they stay at least 25 hours just to make sure the baby's stable.
What about cesarean?
And for a cesarean section, you can go home as early, depending on how you're doing. If you're doing very well, this is your first or second cesarean, you have children at home, you're doing very well, you can go home in 48 hours. But on average, most women stay 72 hours to 4 days.
So one of the reasons to have this during Black Maternal Health Week, and why there is a Black Maternal Health Week, is that Black women die at a higher rate than other women. And the rate of women of maternal death in the United States is high in general. So it's not a good thing, we just suffer more. So they say 60% of all maternal deaths are preventable. So you have to be your own advocate, and you have to make sure people are hearing you when there's something wrong. So that's why we're highlighting that, because we have a lot of issues, and we are suffering from that. question.
Thank you. Thank you again, panelists, for being here. I just had a question more so on like when you find out that the patient has postpartum, what is some type of therapy, I'm assuming, that they would take? What kind of therapy or kind of treatment that they receive to help heal them?
It really depends, but depending on how the mom is and what she's going through, it could be CBT, DBT, because DBT really helps with emotional regulation of the symptoms. It can also be coping skills, right? Because a lot of moms come in, they don't have any coping skills. One of the things in the video that was mentioned was that she doesn't have any time for herself to even shower or do anything. So the first thing I would ask is, okay, how are you doing? How much sleep are you getting? Are you eating a balanced meal? So we'll talk about coping skills, self-care, and how those things is very effective for moms, especially new moms who are still struggling with the fact of trying to balance mom, baby, family, right? And then also thinking about, okay, what's going to happen when I have to go back to work? How am I going to even be able to regulate all these things? So we talk about self-care, work-life balance. We talk about taking breaks. And one of the taking breaks could be breathe. That's a break, you know, because sometimes moms doesn't even have time to even breathe. So these are things that we talk about. And it's very important because a lot of times they would say they have not been heard. A lot of times they would say, I feel alone. A lot of times they would say that, oh, you're strong. You're a strong Black woman. My mother went through it. She's fine. My grandmother went through it. We hear that all the time. And I always like to tell a lot of people, check on your strong friends because your strong friends also struggle as well, right? So, yes, that's what I would do.
Thank you. Great answer. Okay, we're going to squeeze you in, and then Melrose is the final question. Quick question.
I'm going to be very quick. Okay, hello, hi, my name is Ms. Lee. I'm a nursing student at TCI. I see so many beautiful faces here. Thank you, guys, for having us. So, I'm single. And I have no kids. No, I'm just saying that because I saw the movie and the movie impacted me in so many ways that you could ever imagine. And I don't want to get into detail, but I just wanted to throw it out there. So I have a few words that I want to address to the filmmaker. I don't know if he's here. Can we get him here, please? Thank you. Hello, hi, Mr. Smart. So, I just wanted to say a few words to you.
Shoot my shot.
So, I just wanted to take a moment to thank you from the deepest part of my heart for creating such a powerful, honest, and necessary film about postpartum depression. Your work not only sheds light on a topic that is too often whispered about, but it gives voice to the many mothers who silently struggle and feel alone in their experience. You didn't just make a film, you gave hope, validation, and healing. Through your storytelling, you've allowed so many to feel seen, understood, and embraced in their most vulnerable moments. The emotional depth and raw truth you brought to life will stay with me and so many others for a long time. So thank you for your courage, your empathy, and your artistry. You've made a difference. Thank you so much.
Thank you so much for those words. I'm speechless.
One more question. Wrap it up.
I think those were fantastic closing remarks. Let's give her another round. I'd like to call Freddie up. Freddie? And we talked about the village. I want you to know the program here in Nassau County, and there's probably one in where you're from in Queens or the city as well. I'm going to let Freddie talk about her program because this is also a part of the village that these women need. And can you talk about how you would deal with someone going through postpartum depression as well?
Hi, good evening, everybody. And again, thank you so much for joining us.
I actually also work with Joy in the Perinatal Services Network, the outreach work group. But I actually work for VNS Health Nurse Family Partnership. It is a national program, and again, it's just about another resource in the community that can support moms in the pregnancy, but also in the postpartum period. So Nurse Family Partnership is actually a home visiting program for first-time moms. So a first-time mom is paired with a registered nurse, and the nurse follows that mom from the pregnancy until that baby is 2 years of age. So we're there every step of the way. So if we first start working with the mom, of course we're there to make sure that we are assessing her health and providing her a lot of information, insight, a lot of support, which is what that village is all about. Is a little bit differently than, for example, having the mom or a grandma or anybody there. But we're different because we're actually bringing mom with that support from a medical perspective, but also as a friend perspective, because the nurse is there with our mom, again, for about 2.5 years. A lot of what we do is embedded into the national program, which is evidence-based. It's actually based on 3 randomized controlled trials that the agency has done. And part of the program has a mental health intervention within it. And it's all about, well, yes, we do a lot of the screening. So the PHQ-9 and the GAD-7, which is about just monitoring and screening for postpartum, not only postpartum, but perinatal anxiety and perinatal depression, and postpartum anxiety and postpartum depression. So we do a lot of the screening. And when a mom screens positive for those symptoms, of course, we a lot of times encourage them to seek support outside of the program. But within the program, we have a lot of interventions that we can provide the moms with. And sometimes, like the panel was discussing, it's about self-care. Are you making sure that you're taking care of your physical, your emotional needs? Are you sleeping? Can somebody come and help you for 2 hours with the baby while you take a little nap? Or is there any way that tonight somebody can take care of the baby so that you can sleep through the night? Because perhaps that can help you a little bit to cope better with what you're going through. So again, the program's called Nurse Family Partnership, and the program does exist in Nassau County. It is in Queens, Brooklyn, Manhattan, and Staten Island, but it is a national program. And again, thank you so much for all of you to take the time to come and join us today to watch this beautiful film.
I have a question. Is it Medicaid paid?
Is actually a program that is funded through the New York State Department of Health. So it is free for the mom that qualifies, which means that they have to meet the Medicaid income threshold.
So, okay. I'll talk to you.
So a couple things we want to thank Ms. Chim for sharing her story, right? So when we talk about stigma, sometimes people are too stigmatized to share their story. We thank her for that. And we want to thank our panel. Our panel did a great job. And such a variety of health professionals, because it does take a village. And then, of course, we want to thank
Screening and panel discussion for Behind the Joy, a film by Jamal Smart. This film explores the often hidden struggles of postpartum depression. Panelist Joy Williams, Moderator, Allan Toles, MD OBGYN, Northwell Health, Chioma Okoro, MPH Director, Community Health Center, Karen Lockworth, MSN-RN, Icon School of Medicine, Mount Sinai's Doula Program, Beatrice Goodman, MSN-Ed RN, Ribbons Praise Dance Leader, SoulJoy Wellness, Shondell Nicole Goodridge, HCLP Therapist, Helping Hands, Psychotherapy.
you.